It was a crisp autumn afternoon in Boston when Dr. Anya Sharma, a respected neurologist at the prestigious Boston Neuroscience Institute, sat down with her team to address an increasingly common concern among her patients over the age of 60, the silent, often overlooked effects of certain fruits on brain and heart health in later life. For decades, Americans have been told that fruit is an absolute good, a pure, natural, and indispensable part of a healthy diet. And while it's true that fruits are packed with vitamins, antioxidants, and fiber, Dr. Sharma warns that the rules change after the age of 60. Your body in your 60s, 70s, and 80s is not the same body you had at 30, she explained with the calm authority that has reassured thousands of patients. Your kidneys aren't filtering as quickly, your insulin response is slower, and your blood vessels have lost some of their youthful elasticity. These are all natural parts of aging. But when certain fruits are eaten at the wrong time or in excess, they can tip the balance toward dangerous outcomes like stroke or heart attack. What followed was Dr. Sharma's comprehensive fruit caution list. For older adults, 6 fruits that can become problematic if not eaten wisely, and exactly how to adapt so you can still enjoy them without putting your health at risk. 1. Overripe. Bananas, the hidden potassium and sugar punch. Most of us have fond memories of sweet, spotty bananas, the kind that are perfect for banana bread or an afternoon snack. But for seniors, those brown speckled beauties might not be such a harmless treat. The problem: overripe bananas are high in simple sugars and potassium. Their elevated glycemic index means they can cause a rapid spike in blood sugar. When blood sugar jumps quickly, the body responds with a cascade of inflammatory processes, especially in the arteries. Over time, repeated sugar spikes contribute to glycation, a chemical reaction that damages and stiffens artery walls, making them more prone to clots. For seniors, there's a second concern: potassium. While potassium is essential for nerve and muscle function, aging kidneys often have reduced filtering capacity. Too much potassium in the bloodstream, known as hyperkalemia, can disrupt heart rhythm, sometimes leading to life-threatening arrhythmias or even triggering a stroke. A real-life scenario: imagine a retired teacher named Linda, age 72, who enjoys her morning smoothie. She tosses into ripe bananas, thinking she's making a heart-healthy choice. Within an hour, her blood sugar has spiked, and her potassium levels have also risen more than her kidneys can comfortably process. She feels slightly lightheaded and attributes it to just getting older, not realizing the smoothie could be part of the problem. Dr. Sharma's solution: choose greener bananas with less sugar and a lower glycemic index. Eat half a banana at a time instead of a whole one. Pair it with protein or healthy fat like almond butter or Greek yogurt to slow sugar absorption. Avoid eating bananas late at night, when digestion and kidney filtration slow down. 2. Grapes. Nature's sugar bombs. Grapes are often thought of as an innocent snack. They're bite-sized, hydrating, and fun to pop into your mouth while watching TV. But their small size can be deceiving. The problem: grapes contain a high concentration of natural sugars, and they're easy to overeat. A handful quickly turns into 2 or 3. This leads to a rapid surge in blood sugar, followed by chronic inflammation and glycation, the same artery-damaging process mentioned with bananas. Even more concerning, chronic high sugar intake stiffens artery walls and promotes the formation of blood clots, which can lead to ischemic strokes. The portion trap: because grapes don't feel heavy in the stomach, many seniors underestimate their impact. It's the same principle as eating jelly beans: easy to consume, hard to notice the quantity. Dr. Sharma's solution: limit to 10 to 12 grapes at a time. Pair grapes with cheese, nuts, or other proteins, fats to slow the sugar rush. Avoid having grapes as a nighttime snack when your metabolism is slower. 3. Pineapple, the triple threat: bright, tropical, and bursting with sweetness. Pineapple often feels like a vacation in a bite. But Dr. Sharma labels it a triple threat for seniors because of its enzymes, sugar, and acid. The problem: bromelain, an enzyme in pineapple that can thin the blood. This is normally a mild effect, but for someone taking prescribed blood thinners, it can dangerously amplify the medication's effect. increasing the risk of hemorrhagic stroke, bleeding in the brain. High sugar content, contributing to inflammation and glycation. High acidity, which can trigger acid reflux, particularly at night. Acid reflux during sleep can reduce oxygen levels in the blood, putting stress on the heart and brain. A medication warning: if you're on warfarin, aspirin, clopidogrel, or other anticoagulants. Bromelain's blood-thinning effect is not trivial. It can make minor injuries more dangerous and increase the risk of internal bleeding. Dr. Sharma's solution: eat very small portions, a few small cubes at most. Consume pineapple earlier in the day, not at night. Anyone on blood thinners should consult their doctor before making pineapple a regular part of their diet. 4. Watermelon. The overnight dehydrator watermelon seems like the ultimate summer fruit. Refreshing, hydrating, and low in calories. But there's a hidden risk for seniors. The problem: watermelon is a natural diuretic due to citrulline, an amino acid that increases urine production. While this is harmless for many, seniors on prescribed diuretics like furosemide or hydrochlorothiazide may experience excessive fluid loss if they eat watermelon, especially in the evening. Overnight dehydration thickens the blood, making it more prone to clot formation. These clots can block blood flow to the brain, causing an ischemic stroke. Dr. Sharma's solution: enjoy watermelon in moderation and earlier in the day. If you're on a prescription diuretic, discuss watermelon intake with your doctor. Monitor for dehydration signs: dry mouth, dizziness, darker urine, and keep water nearby. 5. Oranges and grapefruit. Medication interferon citrus fruits are a breakfast staple for many seniors, but Dr. Sharma says grapefruit in particular is a major concern. The problem: grapefruit and, to a lesser extent, oranges contain furanocoumarins, natural compounds that inhibit CYP3A4, a key liver enzyme responsible for breaking down nearly half of all prescription medications. When this enzyme is blocked, drugs like statins, certain blood pressure medications, and anti-anxiety meds can build up to toxic levels in the blood. The result: increased side effects, potential organ damage, and a higher risk of stroke. Dr. Sharma's solution: avoid grapefruit entirely if you take prescription medications. Never wash down pills with orange juice. Always ask your pharmacist about food-drug interactions when starting a new medication. 6. Mangoes, a sweet risk for blood sugar and medications. Mangoes are often called the king of fruits, but ripe mangoes pack a heavy sugar load. The problem: for people with prediabetes or diabetes, a ripe mango's sugar content can cause significant blood sugar spikes. Mangoes also contain mangiferin, which, like grapefruit, can interfere with the CYP3A4 enzyme, affecting the breakdown of heart and cholesterol medications. Dr. Sharma's solution: treat mango as a dessert, just a few small bites. Avoid dried mango, which is even more sugar concentrated. Eat mango earlier in the day, paired with protein or fat. The bigger picture: fruit is not the enemy. Sharma ends her guide with an important reminder: the goal isn't to demonize fruit. For most of our lives, fruit is a health hero full of vitamins, minerals, and antioxidants that support longevity. But in later years, it's all about strategy, portion control, smaller servings, more mindful eating, timing. Enjoy higher sugar fruits earlier in the day, not late at night. Pairing: combine fruits with proteins or fats to slow sugar absorption. Medical awareness: know how your medications interact with your diet. And above all, maintain open communication with your doctor and pharmacist.